Intro music. Hey everyone! Today I want to talk about a virus that's making headlines and causing concern for parents across the United States. It's called Parvovirus B19, and the CDC has just issued a health advisory about its rising cases. So what exactly is Parvovirus B19 and who should be worried? Let's dive in. Parvovirus B19 is a common respiratory virus that tends to spike every 3 to 4 years. You've probably heard it called fifth disease or slap cheek syndrome because of the telltale red rash it causes on the face. The CDC has noticed an uptick in cases, particularly among children aged 5 to 9, but it can affect anyone. Now, for most healthy people, Parvovirus B19 is mild and might even go unnoticed. Symptoms often start with fever, headache, and a runny nose, followed by that distinctive red rash. Kids might also get a lacy rash on their bodies and joint pain that can last for a while. But here's the kicker. By the time the rash appears, the person is usually no longer contagious. But this virus isn't always harmless. There are specific groups who need to be extra careful: pregnant women and people with weakened immune systems. If you're pregnant and contract Parvovirus B19, the virus can cross the placenta and affect your baby. This can lead to serious conditions like fetal anemia and hydrops fetalis, where fluid builds up in the baby's body. It's rare, but it's a risk that makes awareness so important. Individuals with compromised immune systems, like those undergoing chemotherapy or living with HIV, can experience severe complications too, including chronic anemia. And let's not forget those with blood disorders like sickle cell disease. They're also at higher risk. So what can you do to protect yourself and your loved ones? Unfortunately, there's no vaccine for Parvovirus B19 yet, but prevention is still possible with some good old-fashioned hygiene. Upbeat music. First, wash your hands frequently with soap and water. This simple step is incredibly effective. Make sure to clean and disinfect commonly touched surfaces like doorknobs, toys, and countertops. And if someone in your household is sick, try to avoid close contact. Covering your coughs and sneezes with your elbow or a tissue can also help stop the spread of respiratory droplets. Dispose of tissues right away and wash your hands immediately afterward. While mask mandates might be gone, wearing a mask in crowded indoor spaces can still offer protection, especially for those at higher risk. Good ventilation in indoor spaces can also help reduce the concentration of airborne viruses. So, what's the takeaway here? If you or your child develop symptoms that might be Parvovirus B19, it's a good idea to consult your healthcare provider, especially if you're pregnant or have a compromised immune system. And remember, the best defense is good hygiene and awareness. Stay informed, stay safe, and thanks for watching. Don't forget to like and subscribe for more updates on health and wellness. Outro music.